Today I'm going to be informing you on the process of appendicitis from start to finish. I would like to begin by giving you a short scenario. A 14-year-old female teen is experiencing nausea, low-grade fever, and 2 previous episodes of vomiting. The mother of the teen tells her to lay down and the pain will pass. 2 hours later, the teen is rushed to the ER and is diagnosed with appendicitis. Today I will be informing you on 3 main points of the process of appendicitis, which is what is appendicitis, who it affects, and the aftercare. According to an evaluation by the National Institute of Health published on December 3rd, 2019, last accessed on May 8th, 2020, appendicitis is the most common general surgical emergency worldwide. Approximately 8% of the human population suffers from acute appendicitis during their 2nd or 3rd decade of life. Today I decided to base my speech on the process of appendicitis because I am a living survivor of appendicitis. And although I experienced the complete procedure from start to finish, I was very young at the time and I wasn't very educated on it. So I decided that I would educate myself during the process of my researching to do a research on something that I had a living connection to. In order for me to give you the one-on-one on the process of appendicitis from start to finish, I will begin by talking to you about what exactly appendicitis is, then the aftercare, and lastly, who it affects. Now, what exactly is appendicitis? First, according to an ebook titled Handbook of Signs and Symptoms by Andrea Ann, published on 2015, last accessed on May 8th, 2020, the term appendicitis comes from the word appendix, which I'm sure most of us are familiar with. But what exactly is appendicitis? Appendicitis is a condition that affects an organ in our body called an appendix. This right here is a normal appendix. It is a finger-sized organ attached to a pouch called cecum below a valve called ileocecal. Now, what happens to the appendix while in the process of appendicitis? Well, the appendix organ begins to swell up and cause severe pain to the umbilical region, which then begins to cause the person experiencing appendicitis to become nauseous and possibly experience high fever. This is a swollen appendicitis. As a result of the strong pain the person is experiencing and the danger of appendicitis possibly bursting, it may cause major future infection and danger to the person's health. During this situation, the patient must get their appendix surgically removed immediately before it bursts inside their body. If the appendix bursts, something called peritonitis will form, which is an infection that will spread all over the abdominal area, and the patient will begin to feel even more ill and cause more nauseousness and fever and severe tenderness in the stomach area. Now, who is affected by the appendicitis? According to Lipkin Visual Nursing book, accessed from EBSCO, called A Guide to Clinical Diseases, Skills, and Treatments by Cantor Deborah, published in 2019, last accessed May 8, 2020, both male and female sexes are affected equally by appendicitis. As for the ages affected, it is said that it could occur at any possible age, but usually occurs between the period of puberty and the age of 25, and is most common in males. According to an evaluation done by the National Institute of Health published on November 10th, last accessed on May 8th, 2020, called Racial Ethnic Disparity in Pediatric Appendicitis Rupture Rate. During this evaluation, the National Institute did a study on children of 2 large states to see if there was a difference in rupture of acute appendicitis difference. During this, the 2 main races were used to compare with the children from California and New York that were Hispanic and Asian. It was found that children of Hispanic and Asian race had a higher rupture rate in California, whereas Asian and African American children from New York had a higher odd of acute appendicitis rupture. All in all, it was discovered that immigrant groups were most at risk due to delayed emergency care. Now, lastly, I would like to inform you on the aftercare process of appendicitis. Once the surgical procedure of the appendicitis is completed, the patient will be under a few medications like morphine to help with the pain that may come after surgical anesthesia wears off. During the recovery of appendicitis, the patient is placed on a special diet of only liquids and no solids whatsoever. The patient will also be placed in a daily vital checkup to make sure the patient's health is running smoothly and no upcoming issues occur during the appendicitis recovery. The period recovery for appendicitis differs in the type of surgery. For laparoscopic surgery, which is a type of surgery done using a camera instrument to perform the surgery, usually takes 1 to 3 weeks for the patient to recover from. If the surgery is done as an open surgery, the patient will take 2 to 4 weeks to fully recover. Now, today I informed you on 3 main points about appendicitis, which were what it is, who it affects, and the aftercare as well. And I showed you a visual of the appendicitis. Looking back at the 3 main points I informed you on today about appendicitis and the short scenario I gave you at the beginning of my speech to become when we come to realization on that 14-year-old we were talking about in the beginning, it is indeed that she was experiencing all the major symptoms of appendicitis. Now, my goal was not only to inform you about appendicitis, but also to give us as humans sort of a wake-up call on any situation where a simple symptom should never be ignored or defined as something normal that will just pass. As we saw in the scenario of the 14-year-old female, the mother's mistake with the teen was to just let her lay off and just let it be. And it would have really had her put her in really bad danger because of the appendicitis bursting. Thank you.